Good afternoon. Welcome to the county's daily COVID-19 briefing. Once again, we ask you to call in your questions for the media and limit yourself to one question and one follow-up. The press conference will be conducted by Chairman Greg Cox.
Thank you and welcome everyone. Joining us today for this daily briefing is going to be Supervisor Nathan Fletcher, who is the co-chair of the board's subcommittee on coronavirus. Also, we will have a report from our public health officer, Dr. Wilma Wooten, and then Sheriff Bill Gore will be making some comments. Today, we're going to first hear about actions at our Board of Supervisors meeting, which was held earlier this morning, and focusing on how we're trying to help residents who are unable to meet their rent and small businesses unable to pay their leases. We also took action to help the many restaurants in our region that are suffering from the sudden downturn in business. And I certainly want to thank Supervisor Kristen Gaspar and Supervisor Jim Desmond for their leadership on this effort. Then we will turn to Dr. Wooten, who will provide us an update on the medical situation. And lastly, we will have Sheriff Bill Gore here to talk about the stay-at-home order and essential businesses. With that, I'm going to ask Supervisor Fletcher to come up and give us more details about today's board meeting.
Thank you, Supervisor Cox. Thank you all for being here. As you have seen and will continue to see in the coming days, and you'll get more details on this from Dr. Wooten, our number of positive tests in San Diego County continue to rise. We expect this trend to continue. We expect it to not only continue, but as more testing is brought online, we expect it to accelerate in terms of our awareness in the coming days and coming weeks. While we're taking action to flatten the curve and slow the spread, we are simultaneously doing everything possible to increase the availability of our healthcare system in anticipation that as we get additional positive cases, there will be additional individuals who need healthcare services, and we want to do everything we can to ensure that those services are available. And so it is a two-pronged effort. I know there's been a lot of discussion about exactly what the future holds in terms of timelines, in particular on social distance requirements, the work restrictions, and others. The reality is at this point we still don't yet know how long we will continue on a trajectory or how severe the impacts will be on our healthcare system. And so there's nothing to indicate a change in posture here in San Diego County anytime in the immediate future, but we will continue to monitor and assess the situation on a daily basis and keep everyone apprised of that. Today, the San Diego County Board of Supervisors had a meeting, our first remote meeting. We took a number of actions in our regularly scheduled meeting. One, action brought forward by myself and Supervisor Gaspar providing protections to tenants, homeowners, and small businesses who have been affected by the COVID-19 pandemic. Particular protections for renters, both individual and commercial, that you cannot be evicted because of an economic impact related to COVID-19. We also had actions to provide similar protections to those who might be facing foreclosure. They will provide relief for up to 4 months without penalty, with the possibility that we can always come back and assess this as we move forward. They will go into effect immediately and remain in effect for now until May 31st. The action we took is similar to the actions the City of San Diego, City of Imperial Beach, and other jurisdictions have taken. Our action today will only apply to those in the unincorporated areas of San Diego County. We also voted to approve providing relief to the food and beverage industry and related small businesses impacted by COVID-19. This action was brought forward by Supervisors Desmond and Gaspar. This action defers health permit fees for food and beverage facilities that are impacted by the county public health order, limiting the operation of restaurants. It directed our CAO to seek additional state and federal funding to address the impacts being felt by the hospitality, food and beverage industry, and provides a path for the county to help the food service industry reopen after the public health order is lifted. We also took action on an item providing guidance on how county employees can be compensated during the pandemic, providing advanced 6 hours to employees who are sick, ensure they have adequate sick time if needed, along with a host of input on other employee-related issues. Then we received a COVID-19 General Board update on the Emergency Operations Center, the federal quarantine, how the county monitors, update on the number of regional cases, along with a broad-based update on how we are responding, testing capacity, temporary lodging, sector outreach, public education campaigns, and others. And last, we directed $10 million in management reserves to be used for the COVID response activities. Those were COVID-related activities. We also had a series of consent items that just ensure our government continues to function and continues to operate in the way everyone would expect. In addition to the steps we took today to help the food and beverage and restaurant industries and to protect individuals facing foreclosure or eviction, I'm pleased to report that the COVID-19 Community Response Fund is continuing to grow. The community is continuing to step up. We are now at almost $6 million total raised from about 1,000 individuals, businesses, and foundations. To date, $950,000 has been granted out to individuals who are in need of help with food security, with rental or utility assistance, with income replacement or gap funding. For more information on this program, you can go to sdfoundation.org/COVID19. The state of California also provides resources to help those who are being impacted, particularly those who are out of work. First, if you are unable to work because you have contracted COVID-19 or have been exposed to someone who has, you can file a state disability insurance claim. Second, if you can't work because you're caring for an ill or quarantined family member with COVID-19, you can file for paid family leave claim. Third, if your employer has reduced your hours or shut down operations due to COVID-19, you can file for unemployment insurance. This provides partial wage replacement with benefits to workers who lost their job or have had their hours reduced through no fault of their own. If you think you were misclassified and you receive a 1099, you may still be eligible for unemployment insurance, and you are encouraged to apply. For more information or to file a claim, you can visit edd.ca.gov. You can also call your state legislative, your local state legislative office if you need help or assistance or clarification on those programs. I know my member of the Assembly has her office open remotely, and they are answering calls, and you can feel free to call their office at 619-338-8090. The federal government also provides resources to help small businesses and nonprofits through the Small Business Administration Economic Impact Disaster Loan Program. If you're interested in applying for these, you can go to sba.gov. So a series of actions designed to provide help and assistance to those who are being economically impacted. With that, I will turn it over to Dr. Wilma Wooten for our Public Health Officer's report.
Good afternoon, everyone, and thank you, Supervisor Fletcher. The following numbers are as of the close of business yesterday, Tuesday, March 23rd. Globally, the novel coronavirus, which is causing COVID-19, has 372,563 positive cases, resulting in 16,381 deaths. Nationwide, there were 41,708 positive cases and 573 deaths. In California, there were 1,873 positive cases and 35 deaths. In San Diego County, there were 230 positive cases and 1 death. But right now, we do know that at close of business today, we will also be reporting 2 new infant deaths, or I'm sorry, 2 new infant cases and 1 additional death in a person in their late 70s. Again, these will be reported at close of business today. For those of you who have tuned in every day, this may sound familiar, but it bears repeating so that there is no confusion. The fact is that 81% of individuals, and this is recent data, who get COVID-19 have mild to moderate symptoms. These individuals do not need to go to the hospital or be tested for COVID-19. The CDC, or Centers for Disease Control and Prevention, has confirmed that individuals with fever and cough can stay home until their symptoms have resolved and they have been free of fever without the use of medication for 3 days, and it has been at least 7 days since the onset of their symptoms. It remains vital that we take the steps to prevent COVID-19. These include frequent hand washing and habitual disinfection, cleaning and disinfection of surfaces. As a community, I know most of us are doing our part to flatten the curve. It is more important than ever that we keep up this life-saving action. As I said yesterday, Things are likely to get worse before they get better, but we do not believe that the local wave of COVID-19 cases has yet crested. It is incumbent upon all of us to do our part to flatten the curve. Please stay at home if you do not need to go out to the grocery to shop, walk the dog, or work as an essential worker under the guidelines of Governor Newsom set out last week. Now, please welcome Sheriff Bill Gore to the mic. Thank you.
Thank you, Dr. Wooten. As you know, on March the 19th, Governor issued Executive Order N3320 with the goal of protecting health through staying home and social distancing. The governor's order recognized that people will have to venture into public spaces, and as such, contains exemptions for those participating in federal critical infrastructure sectors as identified by the Cybersecurity and Infrastructure Security Agency, or CISA. The federal government has identified 16 critical infrastructure sectors whose assets, systems, and networks, whether physical or virtual, are considered so vital to the United States that their incapacitation or destruction would have a debilitating effect on security, economic security, public health or safety, or any combination thereof. Individuals participating in these 16 critical infrastructure sectors may continue because of the importance these sectors are to California's health and well-being. Questions have arisen as to whether firearms retail shops qualify as part of the federal critical infrastructure sector under the CISA's exemption. They are not listed specifically in one of the designated sectors. However, that is not to say that the role of a firearms retailer is not important given the heightened public concern regarding personal security. Licensed firearms retailers provide a valuable public safety service. By conducting background checks, licensed firearms retailers help ensure that those who cannot legally possess firearms are not allowed to purchase them. Licensed firearms retailers conduct firearms registrations, backgrounds, and ensure awaiting periods are complied with. While we must be mindful of the governor's executive order, we also need to ensure that we do not create further public safety risks by driving lawful sales of firearms into an underground or off-books black market during these difficult times. All businesses, regardless of the sector to which they belong, have an obligation to ensure that they are doing everything they can to help accomplish the governor's executive order and the County of San Diego's public health order. These are public health orders aimed at saving lives. They're not public health recommendations to be disregarded if it's inconvenient. I have personally spoken to the governor's top aide, and I'm awaiting further guidance in the coming hours or days ahead, and how his order affects retail firearms sales. Pending the governor's decision, my department will continue to enforce the County of San Diego's public health order. That order specifically provides that all business shall enact social distancing. We've seen many grocery stores, food services, and CISA establishments in San Diego County limiting the number of persons that are allowed in their establishments in order to enforce social distancing. These methods are also now being taken by several firearms retailers in San Diego County who are closing their retail establishments completely or discontinuing sales to discontinuing their sales to walk-in customers and instead conducting firearms and ammunition sales by appointment only. The key here is to limit the number of people that gather in any one location. We cannot have groups of persons gathering in, outside, or near retail firearms establishments. It's counterintuitive to the governor's executive order and the county public health order. That's why we're asking all firearms retailers in the county to find alternative ways to provide their services while complying with the health orders. Voluntary compliance is essential to limiting the spread of COVID-19 in our community. The Sheriff's Department does not have enough resources to police every business to ensure that they are complying with the health orders. Where deputies can gain compliance through cooperation, we will. Where that is not the case, deputies will employ additional enforcement options as necessary in order to gain compliance to the public health and safety. And now I'll turn it back to Supervisor Cox.
Thank you, Sheriff. Now we're going to proceed directly to the questions. And once again, as the last couple of days, we would ask you to state your name and your outlet, and we'll go ahead and start with the first call.
iNewsSource, please state your name and your question.
Yes, hi. My name is Jill Castellano. I'm a reporter at iNewsSource. I obtained an email saying that the city of San Diego is bulk ordering bandanas as a possible mask replacement. I'm wondering if the county is collecting or ordering mask replacements such as bandanas or homemade woven masks to supplement your current supply.
Okay, we're going to ask Rob Sills, who is our Medical Operations Center Director, to answer that question. Rob?
Hello. That's a great question because we are looking out 60 days ahead and what our possible supply is and what alternatives could be like. And that does include the use of bandanas or other supplies if we do not continue getting our supplies in with, through the state and the feds. Right now, not a problem. We do not plan on using bandanas or homemade surgical masks for healthcare providers. We're doing good right now, but looking out 2 months from now, we're making those plans in case it does happen. So yes, thank you.
Okay, thanks very much.
Okay, next question.
NBC7, please state your name and question.
Paul Kruger at NBC7, question for Sheriff Gore. I want to confirm in layman's terms what you said, that you are not enforcing the essential business rule on gun stores. You're not closing them. You're awaiting word from the governor's office that you're going to talk to. And in the meantime, you're telling them that they can sell if they keep people at social distance and encouraging them to work by mail or appointment.
That's a great summary, Paul. No, what we're doing is waiting a word from the governor. I personally talked to his top law enforcement aide this afternoon. They're going to be discussing this with the Attorney General's office in the immediate future, if not later this afternoon, tomorrow. In the meantime, the Sheriff's Department is encouraging firearms retailers to obviously socially distance and, like some have already done, to closing their shops to only online or appointment-only customers. In the meantime, we will be checking with our back with the governor's office and hopefully get that resolved, this resolved in the very near future.
Okay, thanks, Bill. I have two quick follow-ups. One is your comment on the LA Sheriff's decision to enforce cite and close. And two, just confirm that you enforce only in the county. Gun shops in cities would be the purview of those police departments?
Yeah, every police department can enforce these public orders, whether they be from the governor or from the county health officer here. So I've been in contact with Chief Neslight, and I know that they're addressing the same issue.
And LA County,
Yeah.
the sheriff up there has a different read on it than you.
Yeah, he's the sheriff of LA. I'm the sheriff of San Diego County. I'm trying to look at both issues here. The valuable service that gun retailers in this state perform by ensuring that the public complies with the very stringent gun purchasing laws regarding background checks, registration of firearms, what firearms are legal to purchase. My concern is if we put the firearms retailer out of business, we'll create a black market underground during this time of heightened concern by the public for their own security. They will find a way to purchase that firearm in an illegal fashion, which I don't want that to happen either.
Thank you, Bill.
Okay, next question.
Artie from NBC7, please state your full name and question. Artie from NBC7, please state your name and question.
Okay, let's go to the next caller.
Union Tribune, please state your name and question.
Hello, Paul Sisson with the Union Tribune.
Okay, go ahead, Paul.
We received a notice today that apparently went out yesterday to the Stellar Care Assisted Living Center families about a epidemiological investigation there after one of their residents tested positive for COVID-19. I wonder what you can tell us about this investigation and how many people you're testing there, et cetera.
Okay, Dr. Wooten will answer that question.
Thank you for that question. As we do with all of any information that we get about whether it's staff or patients in long-term care facilities, we send a team out to the facility, and an investigation is conducted in collaboration with the staff there to determine if staff have symptoms and if the patients have symptoms. So our staff are investigating this situation, and once it's determined if there are individuals or patients with influenza-like illnesses, the staff there will collect specimens and then send them to our lab for testing. So that's the process, and I don't have and will not release any individual or specific information about this investigation, but know that at this location and all long-term care facilities, that is our process.
I wonder, could I ask a follow-up? Can you tell me whether the folks who are in this facility were in some kind of protective condition in terms of isolation in their rooms? Can you talk about what the community activity level was when this happened?
Well, Paul, I don't know about the community activity level. Last week, we issued a health officer order to limit access or visitation. And in the long-term care facilities that we have visited, the facilities are adhering to that practice. So individuals that go in to visit, as well as employees, their temperatures are checked each day to ensure that they do not have temperatures. And if they have symptoms, they are asked, if they are staff, not to come to work, or they are dismissed. And if there are patients, then they are isolated. That's standard practice and process that's in place, and we are notified, and then we send a team out to conduct the investigation.
Thank you.
I believe we have two more questions online.
Hi, Artie, NBC7. Please state your name and question.
Hi, this is Artie Ojeda from NBC Channel 7. This is for the group. President Trump says he would like to see America open for business in a few weeks. What is your reaction to that? And is this something that is feasible? And who would make that decision to reopen businesses and schools here in San Diego County?
Okay, Dr. Wooten will answer that question.
All of the non-pharmaceutical interventions that we have implemented over the last 10 days need to be in place for a substantial amount of time to see the impact. And in the next week or 10 days is just not ample enough time to see the impact of the interventions that we have implemented. So we need to adhere to the orders that have been placed or issued both at our local level and by the governor until the foreseeable future, at which time we begin to see numbers go down. As I stated in my opening comments, we don't think that we've seen the crest or the peak of the local tests yet. So until we start to see a peak and then the numbers decrease, it is not time to start easing back into business as usual.
And Dr. Wooten, if
Yes. Yes, did you have a follow-up?
Yeah, I did have a follow-up, and it's an important follow-up because I couldn't hear you very clearly over the phone. With regards to deaths that are going to be announced, did you say 2 infant deaths?
Two infant cases and one elderly death, an individual in their late 70s. So 2 infant cases. This is the first time that we've reported cases of infants less than 1 year of age. So again, was letting you know because we know about that now, and the report, end of the day report, will be out at 5 o'clock, and it will include those 3 new cases: 2 infant cases less than 1 year of age and 1 elderly death in their late 70s. And the latter individual had many underlying medical conditions in addition to COVID-19.
Okay, next question.
Voice of San Diego, please go ahead and state your name and question.
We have a couple hundred confirmed cases here, but you guys have told us over and over again not to pay too much attention to that number, and that, you know, it's probably at least 10 times as high as what Dr. Eric McDonald told us. So we've heard other entities like Governor Newsom and like New York City give us some pretty interesting modeling about what percentage of the population will, catch COVID-19 in what point of time, and how many hospital beds are expecting to be filled up. To me, about the modeling that you're doing and what the modeling is telling you. I'd like to hear something about that instead of these numbers, which we know are semi-irrelevant.
Okay, Dr. Wooten?
Well, the numbers are not semi-irrelevant. They are really telling us it is just the tip of the iceberg, just as with influenza every year. Even though this last year we had almost 20,000 influenza cases, that still is the tip of the iceberg. And we know, because we do not have full testing capacity in our region, and that is because access to that, the tests from CDC, then we are standing up Abbott test, where the reagents, it comes with the kit. We do not have to worry about getting reagents. In terms of modeling, we actually are working with researchers and our staff as we speak to focus on modeling, to look at, depending on whether we have 3% of our population or 0.3% of our population, comparing ourselves to other countries and what non-pharmaceutical interventions they utilize. I would ask everyone to understand is that 2 weeks ago, on March 9th, we had our very first case after testing for about 2 weeks. So we are in the process of developing our modeling, looking at any trends as it relates to testing, as it relates to cases, and also as it relates to other variables that that the public, you as the media, and we want to know about in terms of what is the capacity of our hospitals in terms of ventilators, in terms of beds, and all of those factors. So we are doing that as we speak. Not prepared to provide that information today, but we will be able to provide that information very soon.
Just as a point of clarification, we would anticipate at this briefing tomorrow we would have more data available. I believe we have one final call-in question.
KPBS, please state your name and question.
So, hi, this is Shalina from KPBS.
Yeah, go ahead.
I have 2 questions. The first is for Sheriff Gore. Do you mind explaining, sort of just packaging up all of the enforcement mechanisms that the county is going to be taking to enforce social distancing? Like, are these fines? What are we going to be expecting? And then the second is for Supervisor Fletcher. There's been a lot of talk about funding, emergency funding coming from the state for medical equipment and supplies. When should San Diego be expecting to see these increase in resources?
Okay, Sheriff Gore.
Well, first of all, we have not issued any citations yet for violations of either the state or the county's public health order. We're choosing instead to get voluntary compliance, and so far, that's what we've received. We will continue in that vein until we're unsuccessful, and then if it's necessary, we will issue those citations, which, by the way, carry up to a $1,000 fine and up to 6 months in jail. Hopefully, the people of this county will not force us to do that. I think we've been through crisis here before, and I think if we all pull together and work very diligently on that social distancing, we can make this a 2 to 3 to 4 week inconvenience as opposed to a 3, 4, or 5 month inconvenience. So that's what we're trying to educate the public and seek their compliance and voluntary compliance in carrying out these orders. Does that answer your question?
Yes, that's great. So there haven't been any citations. Are you expecting to issue some?
No, we have not issued any citations yet. So far, we've had voluntary cooperation with the social distancing issues.
Great. And then my second question was for Supervisor Fletcher about the resources that are coming from the state.
Yeah, thank you. We've been providing the resources, obviously, that we had internal to us. Just today, we received our first shipment of supplies and resources from the state of California. We will use those to augment the distribution that we're provided to all those who've requested. We also have made another request to the state for additional resources and supplies. It's based on a 10-day kind of burn rate and assumption of what we think we need. And so we have received our first shipment today. We will immediately begin distributing those, and we are continuing to request additional help from the state.
I have a follow-up to that, if that's okay. So how are you going to decide where throughout the county those resources are going to go? And also, can you kind of reveal what was asked for?
I'm happy to have you walk through what we've requested. We'll have our logistics folks request that. But the distribution of them really is made on a priority basis based on what we have available, the requests that are provided, and kind of a priority ranking of our availability to fulfill each request. As to the specific items that we're continuing to request from the state, I'm going to turn that over to Rob.
I believe I heard the question of what specifically we're ordering and when. We're working very closely with our healthcare entities within the county to assess what their burn rate is or their usage rate is based on the number of patients and the total PPE package, not just respirators or gowns or gloves, but the entire package, which includes eye protection. We're projecting out what that is, and then we're making requests up to the state or the federal government through the state to get resupplied. And we are turning those resources requests around as quickly as we can. Thank you.
Okay, we're going to go to the text messages. Would you go ahead and ask the first question?
Yes, the first question is from Lisa Halverstadt of Voice of San Diego. Can you please provide an update on how many motel rooms the county has secured and how many are occupied?
Okay, I'm going to ask Jeff Toney to come up here. He's our Director of the Office of Emergency Services.
Yes, currently our logistics section has been working extremely hard in our Emergency Operations Center. We have currently reserved about 1,900 hotel and motel rooms, which is the highest of any county in the state. And we're going to continue to look for extra capacity and build those capabilities going forward.
Okay, can we get the next text question?
And how many, do you want to say how many are filled?
All right.
And the question was how many are currently occupied. Right now, we've got about 150, and that is a statistic that we'll continue to measure daily.
Okay, next text question.
Yes, from Mary Plummer, iNews Source. Is the county including people who they presume are positive in the COVID-19 case counts or only confirmed cases who've taken the test? And if only confirmed, how many presumed positive cases are there currently in addition to the positives who have taken the test?
Dr. Wooten will answer that question.
So we are no longer using the term presume or presumptive cases. The CDC no longer requires us to send specimens to them for verification. So if we test a specimen and it's positive, that is considered a confirmed positive. We do have to validate tests for hospitals that are coming on board, and once that validation is complete, then their test will also be confirmed.
Okay, we have one more call-in question. Would you go ahead and identify the person and the outlet?
Voice of San Diego, please state your name and question.
Will Huntsberry, Voice of San Diego again. I just wanted to get a little more clarity on the modeling and the estimates from Dr. Wooten. So are you saying that the county has some internal modeling and some internal estimates that they're not ready to release? Or are you saying that the county does not have any internal estimates right now about how many cases we'll currently get over a certain period of weeks?
I believe that I said that we are working, our staff, our epidemiology staff are working with researchers to developing a model for San Diego. We are comparing them. This model will be compared to other countries such as Singapore, South Korea, China, obviously, and Italy. And we will compare to those. We are in the process of conducting modeling for San Diego County. And we are not prepared to release any information today, but we will do so very soon.
Okay, we'll go back to the text questions, and I believe we have two that will probably best be answered by Supervisor Nathan Fletcher.
Yes, this one is from Alex Nieves from Politico. Are certain types of outdoor spaces, like playgrounds and parks, bigger risks than others due to the amount of space and potential equipment that can be touched? And should cities close such venues down?
Well, cities will make determinations on their basis. What we have decided at the County of San Diego is that our open spaces remain open. The contact type structures, whether they be a play structure or a building or a teen center type entity, those we have closed because of the issue that you've raised. And so each jurisdiction will make their determinations for their individual parks and playgrounds and beaches. Yesterday we did issue a public health directive that if a local jurisdiction cannot ensure social distancing, then they shall close those. In the County of San Diego, we believe we're able to ensure social distancing in our fields, in our parks, and our open spaces, but we have closed those contact type structures, the individual playgrounds, in an abundance of caution to try and prevent the spread.
And this question from Cody Delaney from iNewsSource. What can be done to help homeless shelters throughout the county that are low on cleaning supplies, such as hand sanitizer and disinfectant wipes, to ensure they are able to follow the CDC's recommendations for cleaning and disinfection?
Well, we've been helping and assisting a lot of homeless shelters in any number of ways. We can help by installing hand washing stations and helping replenish and resupply those. We're also open to take requests from any entity that's out there in a homeless shelter or hospital system. We'll obviously have to prioritize the ability to fulfill those requests by a priority ranking as determined by our health systems and other type entities. I know we have provided some help and assistance to homeless shelters, and if we are able, we will continue to do that.
Okay, that completes the call-in questions and the text questions. I want to remind everyone that if you have coronavirus symptoms, you can contact 211 San Diego to get connected to a nurse telephone triage line. The line is available 7 days a week from 8 a.m. to 8 p.m. A voicemail is available for callers to leave messages after hours, and a nurse will return those calls within 24 hours. When you dial 211, you'll be asked to select a language and then select 1 for COVID-19 health information. You will be prompted to select if you have symptoms and then routed to the public health nurse line. We have 65 nurses that are answering those lines. And again, we want you to contact your health care provider first if you can, but the public health nurse line is available to all. And again, all you have to do is remember to dial 211. Finally, I do want to end on an uplifting note. Over the past few weeks, we've seen and heard of San Diegans stepping up to help others, and I want to thank them for their efforts. For example, I've heard of distilleries that are producing hand sanitizers for people. In particular, I want to thank Jeff Longernecker, president of the San Diego Distillers Guild. I understand his business, Seven Caves, and another business, Cut Water, recently produced 100 bottles in collaboration with Bill Rogers at Liberty Call Distilling. Mr. Longernecker plans to give away his stock of sanitizers for free or with a donation to the United States Bartenders Guild to help out of work bartenders. I want to thank Mr. Longernecker and Mr. Rogers. Again, American ingenuity has always gotten us through the worst of times, and I believe it will certainly help us weather this situation. I want to thank you all, and to remember to live well, to stay well, but to stay home. That concludes our event today. We'll have our next briefing at 2:30 tomorrow afternoon. Thank you.